For 15 years, ICU nurse Jennifer Morrison was known as the Angel of Death, but not for the reason you'd think. She killed 127 patients with insulin overdoses, and the hospital administration knew. They covered it up because dead patients were more profitable than lawsuits. Welcome back to Crime Secrets, where we expose the predators hiding in the places we trust most. Today's case isn't just about a serial killer. It's about how an entire hospital system enabled murder for profit. This is the story of Jennifer Morrison, the ICU nurse who turned healing into killing, and the St. Mary's Medical Center administration that chose money over lives. What you're about to hear will make you question every hospital stay, every medical procedure, and every person in scrubs you've ever trusted. Jennifer Marie Morrison seemed destined for a career in healthcare from an early age. Born in 1978 in rural Ohio, she grew up in a family where medical service was considered a calling. Her mother was a registered nurse, her aunt worked as a hospital administrator, and her grandmother had been a midwife during the Great Depression. After high school, Jennifer enrolled in the nursing program at Columbus State Community College, where she excelled in both her academic coursework and clinical rotations. Her instructors remembered her as compassionate, detail-oriented, and naturally gifted at patient care. She graduated summa cum laude in 2000 and immediately began working at St. Mary's Medical Center, a prestigious 400-bed hospital in suburban Columbus. Jennifer was hired directly into the intensive care unit, an unusual placement for a new graduate that spoke to her exceptional skills during the interview process. ICU work was demanding, life and death decisions made in split seconds, families in crisis, and the constant presence of death and suffering. But Jennifer seemed to thrive in this environment. Her colleagues quickly noticed that Jennifer had an unusual relationship with death. While other nurses found patient deaths emotionally draining, Jennifer appeared almost serene during end-of-life situations. She would volunteer for the most difficult cases, comfort grieving families with uncommon wisdom, and somehow always knew exactly what to say to ease suffering. What no one realized was that Jennifer wasn't just witnessing death, she was orchestrating. The ICU at St. Mary's Medical Center was the perfect environment for a killer. Patients were already critically ill. Their deaths were often expected, and the high-stress environment meant that staff turnover was constant. Jennifer could blend into the chaos while methodically selecting her victims. Jennifer's weapon of choice was insulin, a hormone that, when administered in large doses to non-diabetic patients, causes fatal hypoglycemia. The beauty of insulin as a murder weapon was its detection difficulty. In critically ill patients, blood sugar fluctuations were common, and insulin broke down quickly in the body, making it nearly impossible to trace during routine autopsies. Jennifer had studied the hospital systems meticulously. She knew which doctors rarely reviewed detailed lab results, which shifts had minimal supervision, and most importantly, which patients had families that wouldn't ask difficult questions. She targeted elderly patients with limited family involvement, terminally ill patients whose deaths would seem natural, and unconscious patients who couldn't report her activities. Her method was devastatingly simple. Jennifer would wait until the ICU was at its busiest, during shift changes, medical emergencies, or when multiple patients required immediate attention. She would then enter her chosen victim's room with a syringe filled with insulin, inject it directly into their IV line, and calmly continue with her regular duties. Within hours, the patient would slip into hypoglycemic shock and die. Jennifer would be the first to respond to their cardiac arrest, performing CPR with the same hands that had just murdered them. She would comfort the family, fill out the death paperwork, and prepare the body for the morgue. By 2008, Jennifer had been working at St. Mary's for 8 years and had killed approximately 40 patients. Her success rate should have raised red flags, but instead, it made her valuable to the hospital administration. St. Mary's was struggling financially, like many American hospitals, and Jennifer's unit had one of the lowest average length of stay rates in the entire medical center. Dr. Richard Hayes, the chief medical officer, began to notice patterns in Jennifer's patient outcomes. Patients admitted to her care had higher mortality rates, but generated less cost per case. From a purely financial perspective, Jennifer was the hospital's most efficient nurse. Dead patients didn't require expensive treatments, extended stays, or costly complications. The first formal complaint came in 2009 when the family of 67-year-old Robert Chen questioned the circumstances of his death. Robert had been admitted for routine gallbladder surgery and was expected to make a full recovery. When he died suddenly from what was listed as complications from diabetes, despite having no history of the disease, his son demanded an investigation. Dr. Hayes personally reviewed Robert's case and discovered the insulin discrepancy. The amount of insulin documented in Robert's chart didn't match the quantity that should have remained in the ICU medication supply. When he cross-referenced this with Jennifer's shift schedule, the pattern became undeniable. Instead of reporting Jennifer to authorities, Dr. Hayes made a decision that would damn the entire hospital. He calculated that a murder investigation would cost St. Mary's millions in legal fees, lost revenue, and reputation damage. Dead patients, on the other hand, generated insurance payouts without ongoing medical expenses. Dr. Hayes called Jennifer into his office and made her an offer she couldn't refuse. Dr. Hayes didn't ask Jennifer to stop killing. He asked her to be more strategic about it. Together, they identified the most expensive patients, those requiring long-term care, experimental treatments, or extended ICU stays. Jennifer would eliminate these financial burdens, while the hospital provided her with protection and plausible deniability. The hospital established what they called comfort care protocols for Jennifer's victims. Families would be told that their loved one was suffering and that the most compassionate option was to let them go peacefully. Jennifer would then administer her lethal insulin injection while family members held the patient's hand, believing they were witnessing a natural death. St. Mary's billing department worked closely with Jennifer to maximize insurance payouts. They would code deaths as expected complications rather than unexpected mortality, which generated higher reimbursement rates and avoided triggering insurance company investigations. Between 2009 and 2015, Jennifer killed an estimated 60 additional patients under this arrangement. The hospital's profit margins improved dramatically. Dr. Hayes received performance bonuses, and Jennifer was promoted to head nurse of the ICU. Jennifer's downfall began in 2018, when Nancy Williams, a veteran ICU nurse, noticed unusual patterns in patient deaths during Jennifer's shifts. Nancy had worked at St. Mary's for over 20 years and had never seen mortality rates like the ones occurring in Jennifer's unit. Nancy began keeping informal records of patient outcomes and discovered that patients were 340% more likely to die during Jennifer's shifts than during any other nurse's rotation. She also noticed that these patients often died during the overnight hours when staffing was minimal and oversight was reduced. When Nancy approached Dr. Hayes with her concerns, he dismissed them as coincidence and suggested that Jennifer was simply assigned to the most critical cases. But Nancy wasn't satisfied with this explanation. She began conducting her own investigation, documenting medication discrepancies and timing patterns that pointed to deliberate murder. Nancy's breakthrough came when she discovered that Jennifer had been accessing the medication supply room far more frequently than other nurses. Security badge records showed that Jennifer entered the room an average of 15 times per shift, compared to 3 to 4 times for other nurses. Nancy made copies of her evidence and contacted the state medical board, the police, and the local news media simultaneously. She knew that if she approached these entities separately, the hospital might have time to destroy evidence or silence her. The investigation that followed was one of the largest medical murder cases in Ohio history. Detective Sarah Martinez led a task force that included state police, federal agents, and medical experts from across the country. When police searched Jennifer's locker, they found a collection of items that revealed the true scope of her crimes: patient identification bracelets, family photos left by grieving relatives, and a notebook containing detailed records of her murders. Jennifer had been keeping trophies from each kill and had written descriptions of her victims' final moments. The notebook revealed that Jennifer didn't see her victims as people. She saw them as problems to be solved. She wrote about inefficient patients who were wasting resources and described her murders as helping the hospital run more smoothly. Forensic accountants discovered that St. Mary's had saved approximately $50 million in patient care costs over the years Jennifer was killing. The hospital had used these savings to expand facilities, purchase new equipment, and pay executive bonuses. Dr. Hayes' personal emails, recovered during the investigation, showed that he had been tracking Jennifer's efficiency metrics and had even suggested specific patients for her to target based on their insurance coverage and expected treatment costs. Jennifer Morrison was arrested on March 15, 2019, and charged with 127 counts of first-degree murder. During her trial, prosecutors revealed the full extent of her killing spree and the hospital's complicity in enabling her crimes. Jennifer showed no remorse during her testimony. She described her murders as mercy killings and claimed she was helping patients avoid prolonged suffering. When asked about the hospital's financial benefit from the deaths, She said she was proud to contribute to the institution's success. Dr. Hayes was charged with conspiracy to commit murder and healthcare fraud. During his trial, he attempted to portray himself as an unwitting victim of Jennifer's manipulation, but his own emails proved his active participation in the scheme. Jennifer Morrison was convicted on all counts and sentenced to life in prison without the possibility of parole. Dr. Hayes received 45 years in federal prison. St. Mary's Medical Center was fined $200 million and placed under federal oversight. The Jennifer Morrison case exposed a horrifying truth about American healthcare. Sometimes the people we trust to heal us are actively trying to harm us. Her crimes weren't just individual acts of murder. They were enabled by a system that prioritized profit over patient safety. 127 families trusted St. Mary's Medical Center to care for their loved ones. Instead, they delivered them to a killer who was rewarded for her efficiency. The victims ranged in age from 34 to 89, included 67 men and 60 women, and represented every demographic and socioeconomic background. Jennifer Morrison's case led to sweeping reforms in hospital oversight, medication tracking, and mortality review procedures. But the damage to public trust in healthcare institutions may never fully heal. The next time you or a loved one enters a hospital, remember Jennifer's victims, because sometimes the person wearing scrubs and a smile is the most dangerous person in the building. If this case horrified you as much as it horrified us, please subscribe to Crime Secrets for more investigations into institutional corruption and systemic abuse, because the truth about our healthcare system is more terrifying than any horror movie.